We spoke to a number of thought leaders who were present at the conference and also people who were speakers presenting. And we found out what were the trends and innovations in UK dentistry at the moment. And we're proud to present this to you in this special broadcast. I'm speaking with Gillian Eastman, who is a CPD training coordinator for dental nursing. She's chairing the dental nursing program as part of the Dentistry show today. Gillian, can you tell us a bit about what nurses who are attending today can expect to gain from attending the courses?
Yeah, nurses will gain an awful lot. The brilliant thing about the Dentistry show is that the program, there is a tailor-made program for the dental nurses. So for that, we've got speakers that are really interesting, really informative, really exciting, because a lot of these nurses might not be lucky enough to work in the type of environment where people actually want to learn. They might work with clinicians who are a bit rural, a bit old school. So what they'll learn today is what's new, what's happening, sometimes how lucky they are. Yes, I do work in an environment where we are up to date. So I say to people a lot of times, don't leave saying, oh, I know that already, woo. What I say to them is think, hooray, I know that, I'm up to date. So they either leave learning, gaining something completely new, a new skill, a new knowledge, or they go away thinking, I'm up to date, I'm really proud of myself. So there's lots of different types of subjects. Our next speaker is in forensic dentistry, which I'm really excited about. It's very unusual, and a lot of people say, well, what's that got to do with dental nursing? But when we look at the careers of dental nurses, we need them to know there is things outside of general practice. Yeah.
Okay, and what do you think are the best aspects of being a dental nurse?
Oh, there's too many to mention. Lots of people have quite a negative experience of dental nurses because they're employed to sit and suck, you know, and that's what people think dental nurses do. But dental nurses have so many skills, life skills, general skills, communication skills, management skills in time management, patient management, people management. They order supplies, they're marketing, you know, they can be front of house when they greet their patients. So dental nurses have so many skills that even they don't realise they use from day to day themselves. And they play a massive role in facilitating the treatment of patients, making sure the patients get the optimum care possible, and making sure the dentist behaves themselves.
And what are some of the frequently asked questions by nurses that you've had posed to you as part of this program?
I think with registration, lots of questions are coming about registration and compliance, make sure they're not being erased from the register, sort of things about responsibility. We're from an environment where the dentist was always responsible for making decisions and the buck stopped with the dentist. But now with registration, we're responsible for our own actions and, you know, we're legally obliged to comply. So lots of nurses are still asking the questions about what if, with regards to infection control mainly, but with regards to staying on the register, definitely.
Hi, I'm Marita Kritzinger. I'm at the Dentistry show at the NEC in Birmingham, and I'm speaking with Kimberly Wingrove, who is a dental nurse and also part of the dental nurse track speaking program here at the show. So Kimberly, can you tell us a bit about what you're going to be presenting about in your talk in a few minutes' time?
Yes, certainly. I'm going to do oral health in practice. So it's more about the dental nurses getting more involved and bringing to patients' attention the best way forwards to help themselves, to just try and bring down the prevalence of oral disease, whether it be caries or whether it be gum disease.
Okay. So you've specialised as a nurse in the oral health education arm of nursing, is that correct?
That's right, yeah. I mean, with the dental nurse's scope of practice changing so much at the moment, there's so much more that we're allowed to do and that we can get involved in. And it just makes our job so much more fulfilling and so much more interesting.
And so I presume your role is also very much hands-on with patients and patient education as well. What do you enjoy about that particular role?
I just really enjoy the interaction with patients, and it's more to do with the fact that I am more involved with helping people to help themselves. I'm actually helping someone make positive changes.
Okay. And what do you think is exciting about being a dental nurse in the current UK dental climate?
At the moment, it is, as I said, the scope of practice. We are now going to start being able to take impressions, do oral health education without special certificates, fluoride application. There's a lot more that we can do now, and I really think that a good dental nurse is the hub of a practice. I really do.